Hi friends, welcome to MedAce. I am your Pharmacology Faculty, Dr. Arpit Agarwal, and I bring with myself over a decade of experience in teaching students across the country and abroad. Now, pharmacology is a very important subject. It not just helps you in cracking various competitive exams, but also stays with you throughout your career and helps you prescribe the correct medications for your patients. But then there is a big problem with pharmacology. What is that? Now you'll agree with me that most students find this as a very volatile subject. Something which is very difficult to remember in first place, but very easy to forget. This creates a fear of pharmacology in the minds of students. What do we do about it? How do we solve this problem? So I have partnered with Manipal MedAce, and together we have created around 70 hours of meticulously designed pharmacology lectures. Now in these lectures you will find that each topic is approached with a clinical viewpoint, which helps you in understanding the underlying pharmacological concepts but also its clinical importance. Now once you understand the clinical relevance of drugs, it stays with you forever. You will also find that the lectures are designed as per the latest CBME curriculum. So they will also help you in passing and securing good marks in your undergraduate second MBBS examination. But that's not all. You will also find specifically curated by myself around 1000 new MCQs that will help you test your knowledge of pharmacology and secure excellent marks in all the competitive examination. But then MedAce does not stop here. MedAce is not just another app in the market. It's an entire new learning ecosystem which has requirements of the first MBBS students to a PG aspirants fulfilled completely. Besides the comprehensive videos, notes, lectures, MCQs, it provides unique features like study plans that help you design your study schedule according to your needs. So friends, what are you waiting for? Download the MedAce app right now and start learning. Thank you.